Hello, I'm Zoe. I expect you're here because you, or perhaps a family member or friend, have been diagnosed with cancer and are about to have surgery or start some other form of cancer treatment. Understandably, you might be worried and feeling overwhelmed. In this video, we would like to support you by showing what you can do to prepare yourself and explaining why preparation is so important. The hospital or your healthcare team might also call this prehabilitation or prehab. Research says that when preparing for cancer surgery or other cancer treatment, you should focus on 3 lifestyle changes. 1. Eat a varied diet. 2. Be physically active. And 3. Take care of your mental health. Focusing on these 3 areas and whatever time you have before your surgery or treatment starts can help you to leave hospital earlier, reduce the risk of side effects, and feel more in control of your health. Also, if you stop smoking and cut down on alcohol, the benefits to your cancer treatment, recovery, and overall health could be even greater. We understand that following a cancer diagnosis, you might go through a period of uncertainty and anxiety, which can lead to a loss of appetite and weight. Being underweight can affect how well you cope with and recover from your treatment. And if you feel like this, try to continue eating using the advice on eating a varied diet in this video. A varied diet means eating a wide range of foods in the right proportions and drinking plenty of fluids to achieve and maintain a healthy body weight. But this doesn't mean you can't allow yourself the occasional treat. So, divide your plate at each meal like this. Each slice shows you how much of a food group should be on your plate. The amount of protein in each meal should weigh the same number of grams as half your body weight in kilograms. Protein is important to build muscle and in preparation for surgery. Also, eating a varied diet with lots of protein helps the body fight off infections and heal itself. If you're already on a special diet because of other health conditions such as diabetes, speak to your doctor, your specialist nurse, or your dietitian to get the diet advice that's specific to you. Cancer and cancer treatments are often compared to running a marathon. In the same way that it's advisable to train before running a marathon, it's important to increase your physical activity before you have surgery, radiotherapy, or chemotherapy. Research shows that you can improve your fitness and build muscle in as little as 2 weeks, so it's worth doing the prehab activities recommended even if there's only a short time before your cancer treatment. You might not have been physically active for a long time, and starting now might feel impossible, but many people who felt the same have managed to do it and feel the benefits. How much physical activity you can do and at what level differs from person to person. Aim for 2.5 hours of moderate or 1.25 hours of vigorous activity per week, as well as some strength building exercises like weight training or yoga twice a week. While it is safe to exercise when you have cancer, you need to do physical activities that are right for you. So speak to your GP or healthcare team for advice on your situation. Being physically active boosts your energy levels, helps with anxiety and depression, and reduces your risk of heart disease and type 2 diabetes. Anxiety or depression often starts at the time of diagnosis or when you're finishing treatment. You might be feeling overly worried or panicked, which are symptoms of anxiety, or you might feel low in mood and not yourself, wanting to withdraw from the world around you, which are symptoms of depression. Try to keep in mind that a big part of what you're feeling during this time is a normal response to a very stressful life experience and a way of coming to terms with it. Getting ready for treatment will help you feel prepared and stop the feelings of anxiety or depression from getting worse. If you're finding it hard to manage, make sure you get the support you need. Taking care of your mental health will improve the quality of your life long term. And research shows that for people with some pre-existing mental health conditions, making the most of that support could better your chance of overcoming certain cancers. We understand you might be going through a lot, and making these lifestyle changes might sound overwhelming. But remember, everyone will have different needs and abilities, so use this video as a guide. Do what you can and be kind to yourself. Don't hesitate to ask your healthcare team for advice. They will want to help you during this time. And once treatment is over, it's important to carry on looking after yourself. So, stick with a varied diet, stay physically active, and look after your mental health. This will all help you live better in the long term.